Before we look into the challenges of cosmetic surgery tourism, we should point out that the British Association of Aesthetic Plastic Surgeons would strongly recommend that you do not leave the UK for cosmetic surgery. However, if you are determined to do so, these are the issues that you must seriously consider. Although it is possible for patients to have satisfactory outcomes from cosmetic surgery abroad, a significant number find that they need treatment when they come back to the UK, either urgently because of surgical complications or being prematurely discharged from care, or later when they discover that they are unhappy with the overall result. The decision to go abroad for cosmetic surgery away from one's support network cannot be taken lightly. Make sure it is your decision. Only agree to a package that is all-inclusive and which clearly defines that your right to cancel at any point is protected without financial penalty, and that your follow-up and the cost of treating complications are covered. Beware of agencies that glamorise combining cosmetic surgery with a holiday. Your welfare is at risk. This idea is misleading and irresponsible. Patients after major surgery require rest and care and cannot enjoy sunbathing, swimming or sightseeing. Ask the same questions as you would for cosmetic surgery in the UK. It's worthwhile checking what the regulations are in the country you intend to have surgery in, as well as qualifications for surgeons, doctors, nurses and other practitioners who may be involved in your care. There are some very well-trained plastic surgeons outside the UK, but it can be difficult to check. In the UK, plastic surgeons will be on the Specialist Register for Plastic Surgery that is held by the General Medical Council, and this can be checked online at the website below. Unfortunately, other countries use different systems, and because of differences in standards and qualifications, it is not easy to find out if a surgeon overseas is a fully trained plastic surgeon. You may find there are professional associations abroad where you can check to see if the surgeon is a member. You should always ask a surgeon what training and qualifications they have and what organisations they belong to. No respectable surgeon will mind this in the least. Beware of any package that doesn't allow you to meet the surgeon who operates on you for a consultation before you agree to surgery. Ensure that there is no significant language barrier during this meeting with your doctor and others involved in your care, in order to ask questions and understand the answers, and bear in mind you may need a translator. Check that the surgeon and the hospital are indemnified for medical mishaps and negligence, and whether it takes into consideration that you are from another country. Early complications can happen 7 to 10 days after surgery, so make sure you have a thorough checkup during this period and that they do not fly you home too early. Remember to ask about what happens, about how any complications during your procedure will be handled, about aftercare, and about any revision surgery that you might need after your original procedure. How will this be provided once you've returned to Britain? Some clinics overseas will not have someone in the UK for you to turn to if problems arise. And for many of those that do, it is a nurse or GP, not a trained specialist. Any potential cost savings that might arise from travelling abroad should be balanced against this, and other considerations such as the need to take time off work and the cost of returning to the overseas clinic for corrections. Bear in mind that both air travel and major surgery increase the risk of developing deep vein thrombosis or a pulmonary embolism. Flying soon before or after an operation abroad combines these risks, particularly if your flight is a long one. Therefore, before flying home, you should wait 5 to 7 days after procedures such as breast surgery and liposuction, and 7 to 10 days after facial cosmetic procedures or tummy tucks. Remember that the Healthcare Commission, which is responsible for regulating and checking private cosmetic surgery in England, does not cover procedures carried out abroad. Unfortunately, it will not be able to help you if you have any problems while overseas. Do not agree to blood transfusion or the use of other blood products unless you are certain that the safety standards meet those of the UK. If you prefer cosmetic surgery abroad because of cheap offers, consider the reasons why cosmetic surgery in the UK may be moderately more expensive. Firstly, stringent and costly regulations for the highest possible standard of care and safety from the Care Quality Commission that the private hospitals in the UK have to comply with. Secondly, UK plastic surgeons have to pay high indemnity fees, often in excess of £40,000 a year, as a safeguard for patients before they are allowed to carry out cosmetic surgery. This is not the case in the rest of Europe, and in most of the developing countries, indemnity against medical mishaps and negligence does not exist. So, the lure of low-cost cosmetic surgery abroad may not always be as attractive as it sounds.